A lot of patients post-operatively, post-bariatric surgery, when I say post-op, have their weight loss, and then they'll go to a local plastic surgeon or somebody who they know, who they trust. And will go due to the fact that thighs are very uncommon procedures that are performed in plastic surgery,
right,
those doctors will recommend a tummy tuck and a breast, kind of like a mommy makeover.
Right.
And so they go through with it. They do the tummy tuck, they do the breast procedure. Then they call me and say, well, I've already had my tummy tuck.
Yeah.
But my thighs bother me so much. And I don't need a lower body lift because I've already had the tummy tuck, and that's essentially half of the battle.
Correct.
So explain to me why we have to, oftentimes, almost every time, we have to do a revision abdominoplasty of some sorts in order to be able to help the patient achieve the result that they want to achieve.
Okay. So great question, actually. So the standard tummy tuck and the tummy tuck that we do are different. The standard tummy tuck, typically, the incision is placed at the junction between the pubic area and the lower abdomen, right? Most people have a slight depression or a line in that. And that's where the standard tummy tuck starts. For our body lift patients, and for most of my tummy tucks, I'm going 1.5 inches into the pubic area. Virtually anyone who's been a mommy or aged or has had significant weight loss will need a pubic lift. Why do they need a pubic lift? Number one, they may have some degree of pubic laxity. And number two, when you do a pubic lift and a tummy tuck at the same time, you end up on the same plane from the side when you look at the patient. Mm-hmm. When you do one and not the other, then you have this. Your tummy is tight and you have a bulge and you have a little bit of a depression in between. So it's always nicer to do the tummy and the pubic lift at the same time. But that means our incisions are typically 1.5 inches lower than the standard tummy tuck incision. That's number one. Number two, I have to lift the thigh fronts up and suture it to the abdominal skin. It's actually far more complex because, like the outer thigh lift, we lift the front of the thighs first by dissociating the fat from the muscle, the fat and skin from the muscle. Then we elevate that on the operating room table. Then I suture that at a higher position. I call those anchoring sutures. And then I close that incision against the upper incision, which is the abdominoplasty. So if you want to get a comprehensive correction of your thighs, you have to start with lifting the front of the thighs and then the outer thighs. So if you've had an abdominoplasty, virtually no abdominoplasty offers you a thigh lift. Therefore, you will need to start essentially at that point and revise the abdominoplasty scar, bringing it lower, incorporating the anterior, which is front, thigh lift into it, then extending the incision. Now, when people have had a tummy tuck somewhere else and then they come, I also have to work with those incisions. If those incisions are placed higher, there's only so much I can bring them lower. Or if they sometimes go towards the back and go up, then there's only so much I can do. As you know, everything I do is with the understanding that I want to end up with incisions at normal anatomical junctions. What does that mean? In the front, your abdomen finishes where your thighs start at your groin crease. Your butt finishes on the back where the lower back finishes, and sometimes we have to create that junction or demarcation. So that's why it's not wise to do an abdominoplasty first and then come back and do the type of lower body lift that we do, because it creates a piecemeal result unless you redo the whole thing.
Right. And that's really frustrating for patients, because when they go on consultations to local plastic surgeons or whoever they know, they're never provided that option, is what I hear. They're never provided with an option, because if they knew that a lower body lift would correct their thighs, which honestly with weight loss patients, that's one of the biggest concerns they have. They would have never spent all that money, downtime, recovery. It's emotional, financial investment that they wouldn't have necessarily chosen to do.
Right.
But because they weren't provided or educated on the different options that are available, because these surgeries are so specialized, right?
Right.
They end up there. And that's more, I mean, out of, let's say 10 body lifts we do, 20 body lifts we do in a month. Let's say we do 10 body lifts, 10 to 12. I mean, at least 2 to 3 of those are include a revision abdominoplasty, wouldn't you say, of some sorts?
Yeah. Most of them require an abdominoplasty revision. But let's go back and talk about this. So according to the American Society of Plastic Surgeons, most plastic surgeons do how many body lifts per year?
1 to 2 on average.
Same with
Thighs and arms.
thighs, buttocks.
Right.
So most plastic surgeons don't do many body lifts.
Right.
And that's why a body lift is such a super specialized procedure.
Right.
Right? And we do about 1 per week.
At least. I mean,
About 1 per week, which is one of the highest numbers in the world, not even just the country. And we have patients coming from all over the world for these surgeries because they recognize that you need to go to a specialized center or a specialized plastic surgeon to perform these procedures.
right. And it's not about saying that other doctors, they're not experienced in it. That doesn't, and I tell patients this all the time, that doesn't mean they're not good plastic surgeons.
Oh, absolutely.
You know, as long as they're board certified plastic surgeons, they are very well trained and equipped.
Right.
But that's when subspecialty comes into play.
Correct.
And when you're dealing with weight loss patients or patients who've had, who need extreme makeovers, it's a totally different ballgame.
Correct.
The skin, the tissue, right?
Right.
The elasticity and all of that. So explain a little bit how
I think you should do this. Actually, I should go home.
I do this all day, every day, 10 times a day.
Right.
But, and I've learned it all from you, honestly. I didn't know any of these things until you taught me.